your student nurse today. How are you?
Good. How you doing?
Doing pretty good.
That's good.
I'm here to do your head to toe assessment. But first before we get started, can you tell me your name, your birthday, and if you have any allergies?
Yes. My name is Jay Langston. I was born December 10th, 2001. I'm allergic to peanut butter and peanuts.
Peanuts and okay. That's a important one. So I'll make sure I will keep that away from you. Okay.
Yes, ma'am.
So today with the head to toe assessment, what I'm gonna be doing is I'm just gonna be assessing your full body, your cardiac, your respiratory system, your abdomen, bowel sounds, your lung sounds. I'm going to be looking at your cranial nerves and how they move, your neurological system. So if you have any questions or any concerns while we are doing this, just let me know. Okay.
Yes, ma'am.
So before we get started, do you have any pain on a scale of 0 to 10, where 10 is the most excruciating pain you've ever had?
It's 0.
0. Okay,
Yes,
good.
ma'am.
All right, so I got your vitals from the CNA, and your vitals were within the normal ranges. Your temperature was 98.6, so that was within the normal range of 96.6 to 99.9 degrees Fahrenheit. Your pulse was 70, and that was within the normal range of 60 to 100 beats per minute. Your respiratory rate was 16, and that was within the normal range of 12 to 20 breaths per minute. Your pulse oximetry reading was within the normal range of greater than 95%, and your blood pressure was within the normal range of less than 120 over less than 80. Okay? So, with that being said, we're going to go ahead and go to the neurological assessment. With the neurological assessment, I'm just going to start with a pen light, and I am going to shine this light in your eye. But first, I want to ask you a couple questions. You've already told me your name. Do you know where you are right now?
Yeah, I'm at BJC Hospital.
Okay. And do you know what today's date is?
It's April 8th, 2020.
Okay. And lastly, do you know why you're here?
To get a checkup.
Okay. Good. So you are alert and oriented ×4 to person, place, situation, and time. I'm going to start with the pen light. I'm just going to obliquely shine this in your eye. And your pupils constricted from a 3 to a 2. Can you follow my pen light for me? And don't move your head. Okay, so that's just me checking your 6 cardinal fields of vision. With that being said, your pupils are equal, round, and reactive to light and accommodation. So that's a good thing. Okay. Next, we are going to check your musculoskeletal system. Can you hold my fingers and squeeze my fingers for me with all your strength? Okay. Can you push up on my hands against my resistance? Good. And then can you push down on my hands? Okay. Thank you. And since I just touched your little toes, I'm gonna foam my hands. You seem pretty strong, Javon.
Thank you.
I'm going to check your skin turgor to see if you're dehydrated. And I don't see any tinting or anything like that. I'm just going to check your temperature with the back of my hands. You seem warm, but not too warm. Your complexion looks good for your ethnicity, so I don't see anything going on there. Okay, next we're going to go to the respiratory exam assessment. And with the respiratory assessment, I'm going to check your lung sounds with my stethoscope, okay?
Yes, ma'am.
I'm going to start with the diaphragm. Take a deep breath in and out. In and out. In, out. In, out. And I'm checking your anterior portion. Then I'm going to go to your posterior portion of the lungs. Here, 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 back over, down, over again, down, over. And what I'm just listening for is any crackles or any bronchi or any abnormal lung sounds that I would hear if you had any respiratory issues. I'm also going to check the lobes of your left lung. And then I'm going to check the middle lobe of your right lung. In and out. Good. So that was the respiratory exam. I'm going to also check your fingers for clubbing. What clubbing can tell us is that if you're not getting enough oxygen, and so if your fingers were more than 180 degrees rounder than what they needed to be, then that will let us know that you're not getting enough oxygen. Okay? So we are going to go to the cardiovascular exam. And with that, I just need you to lay back and get comfortable. I'm going to check your heart sounds again with the stethoscope. I'm going to start with my diaphragm at the second intercostal space. At the right sternal border is going to be your aortic area. The second intercostal space, left sternal border, is going to be your pulmonic area. The third intercostal space, left sternal border, is the Erb's point. Fourth to fifth intercostal space is left sternal border is going to be your tricuspid area. And then lastly, on the fifth intercostal space, mid-clavicular line, is going to be the mitral area. Okay? Next, I'm just going to turn my stethoscope over to the bell sound side where I can hear any low sounds like any murmurs. So again, second intercostal space, right sternal border. Second intercostal space, left sternal border. Third intercostal space, left sternal border. Fourth to fifth intercostal space, left sternal border. And fifth intercostal space, mid-clavicular line. Okay? Good. Since I'm here, I'm just going to check capillary refill. What capillary refill is going to tell us is that you have enough sufficiency of your blood coming back to your fingers. When I squeeze it, it should come back within 2 seconds to red. Looks pretty good to me. Okay, so that is your concludes your cardiovascular exam. With the next exam, I'm just going to check your abdomen and your bowel sounds, okay? Do you remember the last time you had a meal? Last night. And do you remember the last time you had a bowel movement?
This morning.
This morning? Okay, good. Do you have any pain or any tenderness in your stomach area?
No, ma'am.
No? Okay, good. So first I'm going to start at the right lower quadrant, close to the ileocecal valve. That's where most of the sounds are heard. So I'm listening for 5 to 30 clicks sounds. I'm going to go up to the right upper quadrant. Same thing, listening for 5 to 30 sounds. Left upper quadrant. And left lower quadrant. Your abdomen. Okie dokie. I heard sounds, which is good. If I didn't hear anything, I would be referring you somewhere to make sure that you don't have any bowel obstruction or any paralytic ileus or anything like that. Okay, so we did your neuro, musculoskeletal, skin. We did your respiratory, cardiovascular, your abdomen, and now we're going to move on to the pulses. With the pulses, I'm going to start with your carotid pulse, and I'm going to check those one at a time because your carotid pulse takes oxygen to your blood, to your head, and I don't want to obstruct that and make you pass out. So I'm feeling for your carotid pulse one at a time, and they feel bilaterally equal at a 2+. I'm going to go down to your brachial pulses, and it's a 2+ bilaterally equal. I'm going to go down to your radial pulses, and I feel bilateral 2+ there. I'm going to go into the inguinal area with your femoral arteries. Femoral arteries feel bilateral at a 2+. I'm going to feel for your popliteal pulse behind the knee, one at a time, because sometimes it's a little hard to feel that. And so that's a 2+ for both of those, bilaterally equal. Then I'm going to go down and feel your posterior tibialis pulses, and that is a bilaterally equal. Then I'm going to feel for your dorsalis pedis pulse on top of your foot, and that is bilaterally equal. Good. Next thing I'm going to do, I'm just going to check your skin for any edema. I don't see any pitting or anything like that. Your temperature feels good. You're not cyanotic, you're not cold, so I don't think that you had any arterial insufficiencies going on. I don't see any skin breakdown. I don't see any edema, and I don't see any lesions or anything like that. So, do you have any questions for me, Javon?
No, ma'am.
So far, so good?
Yes, ma'am.
Okay, well, this concludes the head-to-toe assessment. I'm just going to put your bed rails back up. I'm going to put your bed lower. If you have any questions, you can call me if you need anything. Here's the call light. If you think of anything, just let me know. I'll be back whenever I can, okay?
Yes, ma'am.
All right. You have a good day.
You too.
Bye-bye.